We'll be looking at another case today. This one's a peripheral case of the wrist. So I want you to look at the information you're given and then go to the test site again, and there's 3 questions on this as there were on the previous one, and go through them, and then we'll review the answers afterwards. This is the type of question you'll get on the written exam. Also, it's similar to the questions you're going to get on the practical exam as well. So again, it makes real strong sense for you to actually sit down and do this. Okay, this is your patient, 38-year-old woman complaining of pain over the anterior wrist. She describes it as a short, sharp stab on using the hand. It's been present for about 2 weeks, and she was treated with anti-inflammatories and with a diagnosis of flexor tendinitis. The treatment helped a little bit, but the pain is still described as severe, and she cannot use her hand without sharp, short-lived pain that aches after the stab for a minute or 2. The pain is not worsening, but it's not improving after the initial improvement with the anti-inflammatories, and there's no past history of similar. On examination, there's exquisite tenderness over the middle tendons of the wrist, and asymmetric contraction of the wrist and finger flexors produce an initial sharp pain that disappears as the contraction is held. Active flexion and extension of the wrist and fingers is severely painful during the movements, but not the extremes of range when the movement stops. Similarly, passive flexion and extension does much the same thing as well. You feel crepitus over the anterior wrist on active flexion and extension. Okay, so the questions are this: what's the diagnosis, what's the treatment plan, and what's the etiology? So there is an answer, or there's a test on testcraft again. This also gives you a chance to practice using the site. And as I say, this is the type of question you'll be getting on the written test, as well as this is very typical of what you may well be asked during the oral practical. So as I said earlier, really have a go at doing this. The score doesn't matter. It won't start to matter for quite a while yet. Just get used to doing this and get used to the way you need to be thinking with these more complex cases. Okay.